Hello, my name's Dr. Julian De Silva. I'm a board-certified facial, cosmetic and plastic surgeon based in London. I'm passionate about giving my patients the very best facial, cosmetic and plastic surgery procedures. I specialise only in the face and have done so for more than 10 years, and my practice is based in central London on the world-renowned Harley Street. We have had patients travel from all over the UK and all over the world in order to have treatment with us, and I have a strong base of international patients who come back to me for repeated procedures. I am very passionate about my patients and providing them with the best possible quality of care and results. And over the last 10 years in practice, we've continued to innovate and provide our patients with the highest level quality of care. These have included innovations such as a patented formulation for sedation anaesthesia, meaning our patients can avoid the potential risks and complications with general anaesthetic. And we've also pioneered the use of various innovations such as the use of regenerative medicine, the combination of lasers and radiofrequency, and used fast recovery techniques such as hyperbaric oxygen and the use of MLD to give our patients the fastest possible recovery after surgery. I'm very passionate about the surgery I do for patients. Over 20 to 30% of all the patients I treat have had surgery elsewhere, and we provide surgery or revision surgery to help those patients achieve the level of results that they were looking for from their original procedure. Now, my training was based in Guy's and St.Thomas's and King's Hospital in London more than 10 years ago, but I also spent time to further my skills, having experienced fellowships both in London, Los Angeles and New York. I feel very passionate about the treatments that I do for my patients, and we have also worked on pioneering research looking at beautification of the face. What makes a feminine face feminine, what makes a masculine face masculine, and enhancing the feminine and masculine areas of the face using the principles of the golden ratio, first pioneered during the Renaissance period, to enhance and beautify the human face. I specialize in only facial treatments and I do no body surgery. And by doing that, this is really surgery of millimeters. In the face, the eyelids, the nose, well, often when we take measurements of these areas, we're looking even to 0.5 millimeter measurements in order to improve aspects of the eye, the nose, the face and neck. And so key is an attention to detail. And I often ask to my patients to bring old photographs so we can look how your face has changed with time, and we can use your old photograph as a template in order to give the best possible natural looking result. I've developed my own customized procedures over the last 10 years, and those procedures are really guided towards giving patients natural looking results and fast recovery, and often there's a mixture between technical detail and measurements and also a degree of artistry, as there's certain aspects of the face, well, you can't actually measure. It's more part of an artistic license that gives the best natural result for your individual characteristics. I believe in providing my patients with both the best possible quality of care, free from complications, and also the importance of the journey and support. I have an excellent team that helps support my patients during the journey, as often swelling can be the #1 aspect of healing and recovery. If you have any questions or you'd like to reach out to my team for a consultation, please contact us because we'd be delighted to hear from you. Thank you.
Is Dr. Julian De Silva, a cosmetic surgeon with 2 practices in London. It's great to have you with us tonight, Dr. De Silva. First of all, give us an idea about the size of your business and the kind of procedures which are very popular.
So I specialize very much in the face. So the 3 principal areas that I help patients with are eyelids and blepharoplasty, nose reshaping and rhinoplasty, and face and neck lifting, those techniques. And I can tell you, just specializing in that one area in the body, it requires a great deal of skill and technique in order to keep up to date with all the advances, and there's continual evolution in medicine, and where we were 5-10 years ago is not where we are today. And as your graphics illustrated, the cosmetic industry has changed dramatically in the last 10 years. Non-surgical treatments, Botox and fillers, were not nearly as accessible, and many didn't even exist 10 years ago. And this is a continual evolution. With every patient I treat, I spend more than 2 hours with every patient before I contemplate doing surgery on them. And that's so I really know exactly what they want, what the patient's expectations are, and also give them an idea of what those risks are. And if I was to give you one example, eyelid surgery, or also known as blepharoplasty, is the most common cosmetic surgery in the world.
Yes.
It's regarded as a relatively safe procedure. However, there is a tiny chance, a less than 1% chance of blindness after blepharoplasty. And I tell every individual patient that there is a tiny risk of this happening. Of course, there are steps you can take to reduce this, to minimize it. However, at the end of the day, surgery is surgery, and occasionally unexpected things occur. And I think that's when we're talking about regulation, we're talking about training staff, whether they're doctors, whether they're nurses or other individuals, so that they're aware of the potential risks of doing some of these procedures. The chance of having complications from a Botox or a filler is relatively very small. However, if you don't understand or appreciate the anatomy of the face or the potential risks, then there's definitely a call for further regulation to help with that.